Are there any risks from having the surgery?
Well, I would say, like I said, if you don't have the surgery, you're going to be at a long-term risk of not getting back to a high level of function. You just can't, especially if the knee is really unstable, and which is ultimately going to lead you into that cardiovascular disease, high blood pressure, diabetes realm of life, which you don't want, deconditioning, those kind of things, or arthritis. You're going to get arthritis anyway, so most of the times you might as well have it fixed. From the risk standpoint, anytime that a doctor injects you with something or does anything where they're going to break your skin, you're always at risk for an infection, which can be pretty scary. I mean, the reality of it is, they say that it's 1 in 100,000 or 1 in a million or whatever it is, but I've seen them. And for the one person that gets that, it's really tough. And so, not to say that it's something that's going to happen to somebody, but it is still a big risk, and it can propose a big problem for somebody if they end up getting some kind of a staph infection, MRSA, in their knee during the surgery, and afterwards they have to go back in, and just simply having to create that insult on the knee in such a short period of time where you're already in this hyper-inflamed state, you're trying to heal, and you have to go back in and do another surgery, and it creates a lot of damage to the tissue. And when the tissue starts to repair, it ends up, it's not pretty, let me tell you that. So, yeah, I mean, there's some risk, but today, reality, these surgeries are kind of like pretty easy compared to what they used to be. They know where to put the graft. They know the foot placements on the tibia and the femur, the footprint of where it exactly needs to be within a millimeter. They know the perfect angle that it needs to be in there. And most of the guys today that are doing the surgeries are fellowship trained. My residency training program that I did was in conjunction with the fellowship for the sports medicine fellowship for the orthopedic surgeons at the University of Cincinnati, and all those guys were being trained to do these with the best surgeons that were available, going to conferences even across the United States talking about how to do these surgeries. The thing that I would caution you though is that the ACL tears and the surgeons and the whole procedure that goes on after the ACL tear, if you're an athlete, should be run by a sports medicine orthopedic surgeon, or a sports medicine primary care doctor, which is a newly evolving doctor out there that's a primary care doctor that has a sports medicine fellowship. The way that an average orthopedic doctor that sees knee replacement after knee replacement after knee replacement is going to look at an athlete in terms of the way that they're going to rehab them, in terms of the graft placements and the choices and all those things are going to be far more inferior than compared to one of these sports medicine trained orthopedic surgeons. Most of them are awesome, and like I said before, there's very, very little risk. And most of the good ones will tell you, if you're watching this now, you should ask your surgeon. They do a big part, but they can't recreate God. That's first and foremost, and that they can't twist the ACL and angle it the same way that it is actually inside of the knee, and you end up with kind of almost like a check rein compared to what it was originally in there. You can imagine this fiber that has different bundles of it that are twisted in that position. They can't take somebody's tissue and try to mold it into that position. It just doesn't work. And so they do an amazing job with the surgeries today, but just as you know, and a lot of others that have had the ACL tears, what happens after the surgery is really the most critical part. Do you start therapy early? Well, I think today most of the surgeons and most of the protocols now, we know we want immediate treatment to begin right afterwards, icing, range of motion, those kind of things. We don't want to let the knee get stiff and function start to decline. And in terms of the return to sport phase, it's really crucial that you get with a physical therapist or an athletic trainer or a personal trainer who has done this. The ability to get back to running and cutting and jumping is not, the ability of somebody to teach somebody that had an ACL tear to get back to running and jumping and cutting, that ability is not all created equal, I can tell you that much, and it's something that I've really focused my career on, and it's difficult. Especially with the girls coming back again, the non-contact ACL tears, when they're running and they just, knee gives out, it's a lot harder to train them in the return to sports phase. You have to be that much more critical of their movement, or all you're going to do is send them back out to get hurt again or to develop another problem. And that's not what we're here to do. We should be here to take that athlete and leave them better than they were before they came to see you the first time. And so with that, I mean, if you come to see me, there's actually going to be a lot of benefit to having an ACL surgery because you might get in better shape.